The liver is the largest organ and the heaviest in the body. It helps to digest food, absorb nutrients, resist infections, remove wastes and poisons, and make vital proteins. But hepatitis infections silently attack the liver, destroying healthy cells.
Hepatitis really means inflammation of the liver. It can be caused by a variety of different things. The commonest cause of hepatitis worldwide is viruses.
Hepatitis is classified by the type of attacking virus. 5 major types of viruses have been identified. Hepatitis A, B, and C are the most common forms of the disease. Hepatitis D and E are far less common, especially in the United States. Hepatitis A is contracted by oral contact with human waste. The most common form of transmission is by food handlers who do not wash their hands thoroughly after using the bathroom. Hepatitis A may also be transmitted by eating shellfish harvested in contaminated waters.
Overseas in developing countries, the problem is sewage, and large outbreaks, epidemics occur when contaminated water supplies are ingested by the population and they get sick.
In the United States, hepatitis A occurs in very high rates in some populations, such as among Alaskan Eskimos, American Indians, some religious communities, closed communities, among actually the Hispanic population in much of the United States. This is primarily a childhood infection there because of close contact, extended families, and routine hepatitis A vaccination is being recommended for those populations.
Immunization is also recommended for travelers to developing countries, homosexual men, people with high-risk occupations, and those with known chronic liver disease. The hepatitis B virus can cause a serious infection. It may be transmitted by coming into contact with infected body fluids, including blood, vaginal secretions, seminal fluid, and rarely saliva. An estimated 1.2 million Americans are believed to be chronically infected with hepatitis B, also known as HBV. And according to the World Health Organization, more than 350 million people worldwide have been infected chronically with hepatitis B.
Yeah, the good news about hepatitis B is that it is preventable. We have had safe and effective vaccines for 2 decades. These vaccines are so safe that they can be given to newborn babies. And in fact, universal vaccination of all newborns is the most effective way of preventing hepatitis B infection that has been in place in this country in 1991, and it has been in place in many Asian countries since the 1980s.
Hepatitis B vaccine provides immunity for 13 years or longer. Hepatitis D, or HDV, is a defective virus that needs the hepatitis B virus to exist. Hepatitis B and D often occur simultaneously and may have more severe acute disease and a higher risk of developing acute liver failure compared with those infected with HBV alone. Hepatitis E, or HEV, is transmitted in much the same way as the hepatitis A virus. Hepatitis E, however, does not occur often in the United States, but travelers to developing nations, particularly in South Asia and North Africa, are at risk. It's spread primarily through contaminated drinking water and is more severe in pregnant women, especially in the 3rd trimester.
Amongst pregnant mothers, there's a high death rate associated with hepatitis E.
Another serious viral infection of the liver is hepatitis C, and that's our emphasis for this program. Hepatitis C causes inflammation of the liver. Inflammation kills healthy liver cells, and when liver cells die, they leave scar tissue called cirrhosis. Cirrhosis impedes blood flow through the liver, resulting in decreased liver function.
It's a constant struggle between the virus trying to replicate and the body trying to eradicate the virus. And that sets up chronic infection, chronic inflammation, scar tissue, and in some people that can lead to cirrhosis over time.
Once cirrhosis develops, you're at risk for either liver failure, where the liver can no longer do its job, or the development of liver tumors or liver cancers.
According to the Centers for Disease Control and Prevention, there are between 4 and 5 million Americans chronically infected with hepatitis C. And according to the World Health Organization, 70 million people worldwide are infected with the virus, the vast majority of them in developing nations. HCV is transmitted primarily through contact with blood or body fluids contaminated with blood. People at risk include IV drug users, healthcare workers, hemodialysis patients, and rarely people who receive transfusions.
Prior to 1992, if you received a blood transfusion, hepatitis C was transmitted that way. It used to be called non-A, non-B. But nowadays, our ability to detect hepatitis C in our blood supply is excellent.
Hepatitis C may also be infrequently spread through sexual intercourse, during childbirth, or by household members living with an infected person.
Now, although this can be transmitted sexually, that's probably less than 5% in this country. It can be transmitted from mother to newborn. That's called perinatal. That's probably around 2 or 3%.
In this country, the sharing of razor blades in a household, household contacts can become infected. Body piercing, tattoos, these are all risk factors for developing hepatitis C.
In tattoo parlors, it's important that customers ask that only new, unused needles, syringes, and ink be used.
When somebody goes into a tattoo or piercing, the person who goes there, they don't know if that syringe and that needle is sterile. And also with the ink, if one patient is infected and goes, for tattooing or piercing, that ink can contain the virus.
Many people with HCV will experience no symptoms. When there are symptoms, they are similar to the flu: extreme fatigue, mild fever, nausea, vomiting. Some patients may have diarrhea, dark urine, and light-colored stools. Some may develop a yellow cast to skin and eyes called jaundice. But a lack of symptoms doesn't mean this quiet killer isn't hard at work inside the body.
Most people with hepatitis C don't have any symptoms. So it's a bit like high blood pressure. You don't know you've got it until the doctor measures it or tests for it.
Norman Quinn is an emergency medical services chief and has been a firefighter in the city of Hallandale Beach in southeast Florida for 25 years.
As a firefighter, paramedic, I spent most of my career on the rescue truck, providing emergency medical services to the community.
Chief Quinn didn't know one particular call in 1988 would change his life forever.
I responded to a call in our city jail. The patient was a prisoner. She was in the jail cell and she was unresponsive on the floor of the cell. I turned her over to check her, and she had been bleeding. Her mouth and gums were covered with blood, and she opened her eyes and spit in my face. I got blood in my eyes. I turned away for a second, and I looked back, and she spit again, and got more blood in my eyes, and all over my face.
It turned out the prisoner had hepatitis C. Chief Quinn didn't know until 10 years later that he had been infected. A routine blood test confirmed the diagnosis.
It is certainly a striking fact that many people with hepatitis C, or for that matter many other chronic liver diseases, don't know they have anything wrong with them, because the liver is a very silent organ. It's a very important organ. It manufactures innumerable proteins and other substances. It filters, it detoxifies. It's a wonderful organ, but it's very quiet. It doesn't complain very much. And that means that people generally don't develop symptoms of liver disease until there's extensive damage in the form of scar tissue.
Experts believe the number of cases of hepatitis C continue to grow for two primary reasons: the lack of public awareness and a lack of effective preventive behavior.
The obvious one would be drug abuse, sharing needles. I mean, that is out. But there are other ways. People have to respect needles. For example, let's say somebody wants to get their ears pierced in the neighborhood, and some young individual is piercing a lot of her friends' ears with the same needle. Respect needles. Respect blood.
Anybody who's ever injected drugs, even once, needs to be tested for hepatitis C.
Thousands of Americans become infected with HCV each year.
When you have 100 patients with hepatitis C, maybe 15 will get better on their own, but 85 go on to this chronic carrier state where many people just simply don't know they have the virus at all. And it's of those 85 that we look at 15 to 17 of them that will go on to develop scarring of the liver, cirrhosis. And of those 17, 2 will develop cancer. So we're approaching this disease to stem the tide of the complications of hepatitis C, which is cirrhosis and cancer of the liver.
Today, new treatments for hepatitis C have improved the outlook for patients with the condition. Newer forms of combination therapy minimize side effects, so patients stay on the treatment and in many cases are actually being cured.
Hepatitis C is treated with antiviral therapy. The cornerstone of the therapy is interferon, which is a protein produced by cells to fight viruses. We're able to chemically synthesize this product as alpha interferon or beta or gamma interferon. And the use of alpha interferon now, given to the patient, is the cornerstone of our therapy. There are antiviral therapies that attack the actual virus at the RNA level and destroy the virus. There are antiviral therapies that attack the coat of the virus and destroy it. So the combination of interferon and several other antiviral medications used together is now thought to be the best way to attack this disease.
The most common antiviral medicine used in combination with interferon is ribavirin. Ribavirin belongs to a class of drugs called nucleoside analogs and works with interferon to help stop the hepatitis C virus from making new copies of itself. These antiviral medicines also help the immune system to kill the HCV. Ribavirin used alone doesn't have any effect on the virus, but combining ribavirin with interferon does help the interferon to be more effective. This combination therapy was a landmark breakthrough in the fight against hepatitis C. It allows doctors and researchers to actually cure the disease. While cure is often the word used, it's more a function of the measure of the virus level in the bloodstream, called the viral load. If the virus level is below a certain number, it is considered undetectable. And as long as that virus remains undetectable, the patient is thought to be cured.
A patient will be considered cured if after 72 weeks of treatment that are divided in two parts, 48 weeks of active treatment and 24 weeks of observational phase, and the viral load at week 72 is undetectable, less than 28, that patient is considered cured.
Patients are closely monitored throughout the 72-week treatment period to see how their bodies are reacting to the therapy.
Whatever the treatment protocol is, the patient will continue it, usually for a period of many months, possibly years. And then we determine whether or not that course of therapy, whatever that protocol was successful or not, by measuring periodically the level of the blood virus. Also, liver biopsy sometimes comes into play to actually see what the liver architecture is doing during the treatment.
We've made dramatic progress in the cure of this disease, and most people think it's a very rational treatment now and are willing to suffer the side effects.
The treatment of hepatitis C is certainly ongoing. Our studies are constantly telling us how to adjust the therapy. And on one hand, we adjust the therapy from the science, and as the new medicines come down on the pipeline, we're incorporating them into well-controlled, double-blinded studies that allow us to make decisions about the best way to treat this disease.
With the cure rate somewhere between 30 and 50%, obviously not every hepatitis C patient responds favorably to the treatment. Those who don't are called non-responders.
With the non-responder, we do have two options. The first option is to continue that treatment to keep the viral load low, or just leave the patient without treatment and to wait for new treatments that are in the track to be approved.
Non-responders can still get some major benefits from treatment. Even if patients don't respond the first time around, doctors say the treatment actually sets the liver's clock back a few years.
So for every year on therapy, we buy you about 6 or 7 years of fibrosis-free living in the future. So the year's worth of therapy is not for naught. Even if we don't cure you the first time around, we can certainly treat you again, but also we've bought you more time, so that more time to wait for another drug, or more time to postpone your liver transplant, or certainly just more time, in this life.
And that was the case for Andy Thomas. She was diagnosed in 1996, completed a year of treatment, but eventually the virus relapsed. So she waited several years and went back for a follow-up biopsy, expecting her liver damage to be worse than before, and got a pleasant surprise.
You could have knocked me over with a feather. My liver biopsy is totally normal now. So the end goal of treatment for me, even though it wasn't getting rid of the virus, it did reverse my liver damage, and I am coexisting peacefully with my virus right now. I'm probably not going to treat until new drugs come down the pipeline.
There's no reason to be discouraged if the treatment doesn't work the first time around. Actually, many people believe that the second treatment may actually have a higher percentage of success.
Everyone in high-risk categories should be tested, especially emergency service personnel like Chief Quinn, who continues to improve now that he's receiving treatment for hepatitis C.
When I started in this business, the firefighters wore blood like a badge of courage. We didn't have personal protective equipment at the time.
Since 1985, the fire rescue gear includes thicker rubber gloves, protective sleeves, protective face gear, protective eyewear, and in some cases, gowns and completely capsulated protective suits. Even though many more hepatitis C patients are being cured with available treatments, there are still many thousands, like Charles Moxley, who either do not receive treatment in time or for whom the available treatments don't work. The last resort for end-stage HCV patients is liver transplantation.
So gradually, now it's taken me 12, 13 years to reach this point of where it was determined that I better get a liver transplant.
And as more patients are diagnosed with hepatitis C, the number of people needing liver transplants will also increase.
Unfortunately, in this country, there are more candidates for liver transplantation than there are donor organs available.
Charles was one of the lucky ones. He got a liver and now looks forward to a healthy future.
The feeling that I have now is it's just marvelous. At least we caught it in time that it looks like I'm going to have a fairly productive life, and I expect to be around for quite a while.
And as the pace of research continues to increase, many more hepatitis C patients are looking forward to new treatments that can give them the option of a healthy future.
I think in the next decade we'll witness some very important advances that get our cure rates way above the 55% figure. There aren't any novel drugs that are anywhere near ready for marketing. These are all still early phase trials. But there's such a wealth of not only ideas, but actual prototype products out there, that we're very optimistic, and I find it very important to share that sense of optimism with my patients.
My message for the patient who is a chronic carrier of hepatitis C and feels well, see your doctor, understand that there is treatment available, and be very hopeful. Because in my field of gastroenterology, I would say that the number one research, the money that's being spent by drug companies and the efforts at beating this disease, it's hepatitis C. That's where we're going to have our big breakthroughs.
Hepatitis C continues to be an extremely infectious disease. Caution should be practiced by anyone who comes in contact with blood or any object contaminated with blood from another person. And although the virus is only infrequently transmitted through sexual intercourse, using a latex condom may provide additional protection.